Hello everyone, I am Sean Famous, a nursing student from LaSalle University. In this video I'll be talking about the arthritis, and what are types of arthritis and causes, nursing management, sign of symptoms and risk factors, and also the treatment options. What is arthritis? Arthritis is defined as an acute or chronic joint inflammation in the joint. Arthritis may attribute to a wide variety of symptoms that include pain, stiffness, decreased range of motion, and joint deformities. There are several different types of arthritis, with management being different for each. History and physical examination are crucial in recognizing the type of arthritis, while additional laboratory and imaging may sometimes be necessary for confirming the diagnosis. Types of arthritis. First is gout. This type of inflammatory arthritis that causes pain and swelling in the joints, usually is flares that last for a week or two and then resolve. Gout flares often begin in your big toe or a lower limb. The main causes of gout are eating and drinking food and drinks high in fructose. Having a diet purines, which the body breaks down into uric acid. Rheumatoid arthritis, or RA, is an autoimmune and inflammatory disease, which means that your immune system attacks healthy cells in your body by mistake, causing inflammation, painful swelling in the affected parts of the body. RA mainly attacks the joints, usually many joints at once. Osteoarthritis is the most common form of arthritis. Some people call it degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hands, hips, and knees. With osteoarthritis, the cartilage within a joint begins to break down and the underlying bone begins to change. Fibromyalgia is a chronic, long-lasting disorder that causes pain and tenderness throughout the body, as well as fatigue and trouble sleeping. Scientists do not fully understand what causes it, but people with the disorder have a heightened sensitivity to pain. What are the causes for arthritis? Family history. Some types of arthritis run in families, so you may be more likely to develop arthritis if your parents or siblings have the disorder. Age. The risk of many types of arthritis, including osteoarthritis, rheumatoid arthritis and gout, increases with age. Sports injury. Contact sports and individual activities are potential risk factors in developing osteoarthritis, such as football, soccer, basketball. What are the causes for arthritis? Autoimmune disease is the most forms of arthritis are thought to be caused by a fault in the immune system that causes the body to attack its own tissues in the joints. This may be inherited genetically. Other forms of arthritis can be caused by problems with the immune system or by a metabolic condition, such as gout. Signs of symptoms for arthritis. First, pain, swelling and stiffness in one or multiple joints. Second, morning stiffness in and around the affected joints lasting at least 1 hour. Third, reduced range of motion. Fever, anemia, weight loss and fatigue. People who have experienced these symptoms will have arthritis disorders. For nursing management, there are 3 ways to manage this disease. First, rest and exercise. Since doing with regular activity will replenishes lubrication to the cartilage of the joint and reduces stiffness and pain. Exercise also helps to enhance energy and stamina by decreasing fatigue and improving sleep. Exercise can enhance weight loss and promote long-term weight management in those with arthritis who are overweight. Second, is physical therapy because it may also help ease arthritis symptoms, reduce the need for pain medication, and even delay or negate the need for surgery. Physical therapy for arthritis may include exercises to improve joint mobility and tips on posture and movement that can help a person work around pain and avoid injuries. Third, nutrition. Eating a balanced diet. Eating a diet with all the vitamins and minerals you need is important for everyone, but for people with arthritis it could help reduce the side effects of some drugs and protect you from conditions affecting the heart and blood, which can be a complication of some forms of arthritis. There are 3 risk factors of arthritis. First, obese. People who are overweight or obese are more likely to get knee osteoarthritis than people who are not overweight. Excess weight can also make knee osteoarthritis worse. Extra weight puts more stress on joints, particularly weight-bearing joints like the hips and knees. What you can do: maintain a healthy weight. Second, advancing age. Arthritis is not just limited to older adults. While arthritis is more common among older adults, arthritis develops in younger people too. 1. Among adults aged 65 and older, 50% report ever having been diagnosed with arthritis. Since the cartilage also goes through a degenerative process, which is when arthritis can develop. Ligaments and other connective tissues become less elastic and flexible with age. Because of the changes that occur within the musculoskeletal system as we age, our joints typically develop a decreased range of motion. Third, female gender. Why female mostly affected arthritis disorders? According from my research that there is one reason. At first the women's tendons move around more because, to accommodate childbirth, they are more elastic and also more prone to injury. Also, women's wider hips affect the alignment of the knees in a way that leaves them more vulnerable to certain types of injuries, which translates to more arthritis down the road. Arthritis is a term used to describe a group of inflammatory joint disorders that involve the inflammation of one or more joints. The pathophysiology of arthritis is complex and can vary depending on the specific type of arthritis. However, there are some common underlying mechanisms that contribute to the development and progression of arthritis. First step is synovitis or synovial inflammation is when the synovium of a joint becomes inflamed, swollen. The synovium, which is also sometimes called the stratum synovial or synovial stratum, is connective tissue that lines the inside of the joint capsule. Second step is cartilage destruction is caused by matrix metalloproteinase (MMP) and a disintegrin and metalloproteinase with thrombospondin motifs (ADAMTS) produced by chondrocytes, synovial fibroblasts, and synovial macrophages. In RA, there is an excessive immune response of T cells. For third step, subchondral bone changes refer to alterations that occur in the bone just beneath the cartilage surface of a joint. This area is known as the subchondral bone and plays a crucial role in joint health and function. Subchondral bone changes are commonly associated with degenerative joint diseases such as osteoarthritis, but they can also occur due to other conditions or injuries affecting the joint. Fourth step is synovial hyperplasia, also known as synovitis, is a medical condition characterized by inflammation and proliferation of the synovial membrane, which lines the joint cavities in the body. The synovial membrane is a thin layer of tissue that produces synovial fluid, a lubricating substance that helps reduce friction between the joint surfaces and nourishes the cartilage. Last step is arthritis is a broad term that refers to the inflammation of one or more joints, resulting in pain, stiffness, and swelling. There are various types of arthritis, and autoimmune mechanisms play a significant role in some of them. The two most common types of autoimmune arthritis are rheumatoid arthritis and juvenile idiopathic arthritis. Let's delve into each of them. Rheumatoid arthritis and juvenile idiopathic arthritis. In both rheumatoid arthritis and juvenile idiopathic arthritis, the immune system attacks the synovium, causing inflammation and damage to the joints. Early diagnosis and appropriate treatment are essential to managing the symptoms and preventing further joint destruction. Treatments for arthritis. First, take NSAIDs or nonsteroidal anti-inflammatory drugs. These medications work by limiting the release of chemicals your body produces called prostaglandins, which promote pain and inflammation. Specifically, almost all NSAIDs do this by blocking two enzymes, COX-1 and COX-2, that play a crucial role in making prostaglandins. Without appropriate treatment, chronic pain, disability, and excess mortality are unfortunate outcomes of this disease. Lifestyle changes is very helpful to treat arthritis. Arthritis surgery can help repair or replace a damaged joint. In doing so, it can reduce pain and improve the way the affected joint functions. There are different types of arthritis surgery, including arthroscopy, joint resurfacing, osteotomy, and TJR. The prognosis for arthritis is when left untreated, the risk of mortality is increased. Untreated people with arthritis are twice as likely to die compared with unaffected people the same age. Last information for arthritis is health teaching. This teaching helps the client who has diagnosed arthritis, but there are some cases that arthritis can be reduced, especially in female women and also the older clients. Hear how to keep your bone healthy as you age. There are some following teaching that you must know on how to treat and prevent this arthritis. Stay healthy. Weight. Clearly, being overweight increases the load placed on the joints such as the knee, which increases stress and could possibly hasten the breakdown of cartilage. Control your blood sugars. People with arthritis have a 61% higher risk of developing diabetes than those without this joint disease. In addition, uncontrolled diabetes can affect the muscles and skeleton, leading to joint pain, nerve damage, and other symptoms. Also, according to the Arthritis Foundation, almost half of all adults with diabetes also have arthritis. Stretching particularly benefits those with arthritis by lubricating joints and enhancing and maintaining range of motion. But there are some basic cautions to consider when adding stretching to your exercise routine. Exercise. Just 30 minutes of exercise 5 times a week helps joints stay limber and strengthens the muscles that support your knees and hips. Focus on low-impact exercises like walking, cycling, or swimming. Avoid injury. An injured joint is more likely to develop arthritis than one that was never injured. Wear protective gear when playing sports and always lift with your knees and hips, not your back. Next, quitting smoking can ease the pain from swollen and tender joints that accompany rheumatoid arthritis, because smokers are more likely to suffer traumatic injuries, such as sprains or fractures. Smoking is also associated with a higher risk of low back pain and rheumatoid arthritis. Smoking is also associated with a higher risk of low back pain and rheumatoid arthritis. Eating fish twice a week helps to treat arthritis because oily fish contain long-chain omega-3 polyunsaturated fatty acids, and research has shown these acids can reduce inflammation and disease activity in people with rheumatoid arthritis. Get routine preventive care. Your doctor may be able to suggest lifestyle changes that can help reduce your risk or slow the progress of arthritis. Thank you for watching. Please like and subscribe for more videos.